According to the National Institute of Drug Abuse, every day, more than 130 people in the United States die after overdosing on opioids. The misuse of and addiction to opioids, which includes prescription pain relievers, heroin, and synthetics such as fentanyl, is a serious national crisis that affects public health as well as social and economic welfare. And while there are many avenues of treatment, once a person has become dependent, some experts feel not enough emphasis is being put on the practices that can prevent opioid addiction from occurring in the first place.
The traditional approach to surgery was the patient would come into the operating room, we would give an opioid fentanyl during the operation, they'd go into recovery on the floor and they would be getting more opioids IV, and then they'd get a 30, 60, or 90 pill supply of pills to take home during their home recovery. Research has shown that about 6% of patients who have not had opioids prior to their surgery event end up with a persistent or long-term problem with opioid addiction. When you move to the belly and the knee, those numbers go up to 10 to 15%. Consider for a moment, there's 50 million anesthetics done each year. And you can quickly do the math on that. That is a lot of people at risk for a long-term problem.
The good news is there are alternatives to opioids used during or after surgery, which can help alleviate the need for post-operative narcotics pain medicine in a large portion of the population.
In my role as a CRNA, I see reducing the opioid use in the operating room as something really significant. I have taken care of thousands of patients, and when I consider 6% of those people I put to sleep may have had a persistent problem, that really makes it personal for me.
Founded in 1950 and located in suburban Nashville, Middle Tennessee School of Anesthesia is celebrating more than 6 decades of providing graduate-level anesthesia education and training of nurse anesthetists. The only independent accredited anesthesia institution in the nation, MTSA offers a one-of-a-kind program focused on acute surgical pain management.
The mission of the Middle Tennessee School of Anesthesia is to provide a holistic approach to healthcare, reflecting Christ in anesthesia education, and to develop excellence within the nurse anesthesia industry. We just see this new venture of ours with the opioid crisis and combating that as just really fitting in well. The reason MTSA has really picked this up as a focus of education is because we only educate CRNAs, and CRNA staff primarily rural hospitals, and we all know that the biggest opioid problem is the rural communities, so it's our way to combat the epidemic.
The fellowship is designed to train anesthesia providers on current methods of managing acute surgical pain to reduce patients' experiences and complications that they may have with pain postoperatively, and then overall to reduce the amount of narcotics. And we're trying to train anesthesia providers to take that information they learn within this fellowship and teach others and continue to improve patient outcomes and satisfaction that a patient has when they undergo a surgical process.
By instilling excellence through innovative and diverse clinical offerings, we're training the next generation of CRNAs and raising awareness on how to deal with pain during and after surgery with less dependence on opioids. Our graduates truly make a difference, one patient at a time.
In the fellowship training here at Middle Tennessee School of Anesthesia, what I realized was that all the ultrasound-guided regional anesthesia that I was already performing in my practice was very beneficial. But I learned so much more than just ultrasound-guided regional anesthesia. I learned that there's multitudes of non-pharmacologic and pharmacologic things that we can do to manage patients well. For instance, we need to engage in their spiritual practices. We need to think about different types of mindfulness meditation, different things that we can do that help manage their pain well, help reduce their anxiety, and help them be comforted. So it's much more than just the pharmacology and the ultrasound-guided regional anesthesia. It's all encompassing.
At Middle Tennessee School of Anesthesia, the regional anesthesia techniques that we learn through the Acute Surgical Pain Management Fellowship allow us to provide better patient care and minimize opioids to various patients.
Building upon our relationship with the American Association of Nurse Anesthetists, we want to continue to develop partnerships in bringing forth new technology and also moving towards scholarship and research so that we can bring new and novel approaches to the caregiver at the bedside.
Certified registered nurse anesthetists impact the quality of healthcare every day in hospitals, clinics, and surgery centers across the country. And our students are doing their part to prevent opioid abuse before it happens. There are alternatives to traditional narcotics used for surgery and pain management. Learn more today about the Middle Tennessee School of Anesthesia, reflecting Christ in anesthesia education. For more information, visit mtsa.edu.